I'm telling you to focus on how you think and not just the content, okay? There's no way that you're gonna remember and know everything that you've been taught in nursing school. It's just not gonna happen. And it gets so much deeper and so much broader than that even. So you can't know it all. How many conditions or issues have we talked about here that were either completely unknown to you or fuzzy, right? So you just can't know all of that. So one of the things that I want to talk about for just a minute is how to figure out the answer to the question even when you don't have any idea, okay? So this question, let's have Danielle. The nurse administers dactynomycin to the client with testicular cancer. The nurse teaches the client to report which symptoms to the healthcare provider immediately. What do you think? Walk through the answers.
So the first answer is abdominal pain. This medication is an antibiotic, and antibiotics can upset the stomach. This is where I'm going with it, like my thinking. Transient nausea. Once again, I would say that's a common thing if you're taking an antibiotic. Moderate fatigue. Maybe. I mean, he's got cancer. He's got testicular cancer, so that may be normal. Generalized alopecia. Not sure. And a diffuse rash. That sounds kind of important.
Okay. So what would your answers be about what needs to be reported immediately?
I would say the rash, because that might mean that there's an allergic reaction to the medication.
Okay. What do you think about her thinking?
I was kind of thinking the same thing.
Okay.
With the alopecia being generalized, I feel like either progressed to the rash or it's just common. I don't know. It's just stop there.
I think it's E.
Why?
It says diffuse rash.
Okay.
You wouldn't want a diffuse rash. And then the ending of the medicine is mycin. When we talked about vancomycin earlier, it could be related to that with the red man syndrome.
Okay. Take a look at that stem again. What does it say?
The nurse teaches the client.
How about the sentence before that? Who are we giving this medicine to?
Male.
Testicular cancer.
Do you still think it's an antibiotic?
Maybe not. Maybe it's chemotherapy.
Chemotherapy drug.
So you're not going to see things in the stem that are distractors. If it's in the stem, it's in there for a reason. All right? So when we talk about using context clues to help answer a question that you're not sure about, that was your clue. Okay? It doesn't say anything about any kind of infection. It doesn't say anything that should lead you to believe that the person has an infection. It only says that they have cancer. So for this one, technically it's an antibiotic. It's an anti-tumor antibiotic, which makes it a chemotherapy. So what clue in your answer choices could have led you to understand that it was maybe something besides an antibiotic? What is alopecia?
Hair loss.
Hair loss. Does any antibiotic cause hair loss?
No, but chemotherapy drugs do.
So you have a Q in the stem with testicular cancer, and then actually a Q in your answer choices with alopecia, right? Because that doesn't make any sense, and that should make you stop and reread it and look at what your context clues are. So if you don't know anything else about this drug or this situation, those two Qs should have helped you think maybe this isn't an antibiotic just because that's what I know. Does that make sense? So if we now think it's a chemotherapy drug, which choices are the issue? Which things are expected versus unexpected?
You're expected to have nausea, be tired, have alopecia.
Which things do you not expect?
Abdominal pain.
Abdominal pain and rash.
They shouldn't have abdominal pain and a rash.
So this is select all that
So
apply.
this was a select all.
Yeah.
I wouldn't know.
That's perfect.
Select all that applies can be just once. I left it out in one place. Golly gee.